This is Commissioner Frank Avila Speak, and the name of our show is Health Risks of Eating GMO Foods.
Yeah.
And as my guest, I have Reverend Velma King, and Velma King is well known throughout the United States on how to save the planet. Thanks for being on our show.
Well, thanks
Velma.
for asking me to come.
Yes. And you know, Velma, every time I pick up a paper or read an article, they have something about GMO foods, pros and cons on GMO. And it's a GMO. What is GMO?
Well, GMO, those letters stand for genetically modified organisms. And so that means for the everyday person who eats GMO food, that means that food has been changed from its natural state in some way. Now, sometimes it is something within the seed itself, or the pesticides used to, in other words, Monsanto is the #1 organization that produces GMO seeds. Well, those seeds can resist pesticides and do other things. But when scientific research has looked at a second look, when they say, oh, it's safe, well, when you start doing actual scientific research in the labs and where they do these tests on mice, we give thanks for the mice who lose their lives.
Yes.
But they find these animals have allergic reactions, cancer, as much as cancer, all kinds of reaction to anything associated with genetically modified organisms. And so it has become so, it was first, it was the big thing in the news in the food production, simply because, first of all, they had this noble idea that we can now make bigger crops because the foods, we'll save a lot because the pesticides will keep the pests down, and we'll have more crops and all of that, and we can save world hunger. Well, they put all those noble ideas out there, but the actuality of what's really happening is they really want to have more profit. And that's, you know, nothing's wrong with having higher yields and more profit. But the nutritional value is compromised when there's an element in that seed that causes problems to human health, animal health, and environmental health. All three are affected. And so we see, for instance, I have a little list here. So you said, well, what foods are in? Well, let's just look at.
Also, you mentioned that because they're using GMO food, or to grow GMO food or seed, that it'll grow more yield per acre. I wonder, I was reading a study, and I can't recall where it came out of, but they're finding that it doesn't yield more per acre on the crops.
Yeah, because, well, they're still searching around, but still trying to applaud genetically modifying foods. For instance, I was at a hearing sometime last year, it was, because they listed the pros and the cons. Well, most of the cons is they just don't want you to have the label on it, so it's your choice. You should be, any consumer should be knowledgeable of what they're eating. But if you have a resistance to the idea of genetically modifying foods, whether it's for environmental reasons, for human health reasons, or for spiritual reasons, you don't get to make that choice if the label is not there. And so you're starting to see more labeling done in the health food industry, because now you'll see organic, you see the big V for vegan, which I like, And you also see non-GMO ingredients. So this is informing us that
Yes.
this is something safe. And we don't care if we pay even as much as $1 more for a product, because we're protecting the lives and the health of our family members.
And we're staying healthy, so we could go to work. If we're sick, maybe we'll miss 1, 2 days or 5 days of work. So we're losing money.
Right.
And so if we're paying $1 more, we're staying healthy, and we're gaining maybe $5 or $10 by going to work.
Well, the other side of it is just when you look at the way America has evolved over the few centuries, we're not preparing our foods. We're looking for quick solutions
Processed
for
food.
everything. So we're eating processed foods, and most of them have genetically modified ingredients in them. We're also looking for something cheap, and you know, we want it quick, we want it cheap, and we want them to make it. We are not making our food at home, and this is the solution actually to genetic engineering foods. Just do organic foods, and stop talking about how organic foods. I said genetic, I meant organic. Organic foods are no longer too high to purchase. Now let's think about today's budget. Today's budget, certainly we know that the household expenses, but the household expenses today now includes everybody, including Junior and Baby Junior, has to have a phone, an iPad, an iPhone, an I this and I that. And then, so we have put that, and then we all have to have cable, because we used to watch regular TV. I don't have cable. I'm not sorry to say, because there are not a good programmings on standard analog TVs, and I keep my analog and all of that, and I watch tons of good movies and things like that. But I'm just saying, we've evolved away from the family, away from the table, away from mom cooking in the kitchen and dad coming in and say, food's not ready, how can I help? And they're all helping, the things that bring the family together. So on the backside, they're saying, oh, they're distracted, but they still want to eat this food quick and easy, and we want to do more yield so that we can sell it cheap and all of that at the risk of human health, because studies have been done. Now let me just, I did pull out some articles from the internet, and this is from one that says, according to the United States Department of Agriculture, as of 2010, at least 80% of corn and approximately 90% of soybeans grown in the United States are grown from genetically modified seeds. Genetically modified, or GMO foods, are crops grown from seeds engineered to increase yield and lower production costs. See?
Lower, yes.
More food, less cost. Proponents of GMO say that the higher yields and improved nutritional content are necessary to ensure adequate food for the world's growing populations. Opponents say any claimed benefits from GM foods are unproven and cite the lack of safety studies and the real and potential dangers to human health and the environment as reasons to ban these products. Now, in other countries, GMOs are banned.
Oh yeah,
in major countries like England, you know.
Now you mentioned corn, right?
Yes.
What do they make out of corn? Oil.
Oil.
Corn sugar.
That is correct.
Corn syrup.
Corn syrup. We
Now,
don't know about that.
That's all GMO.
But now, what are they doing now? Because they found out that just a minor health risk, fructose, high fructose corn syrup causes extensive weight gain.
Yes.
But it was cheap, and also the idea of the food manufacturers to get something sweet into all foods, because sugar causes you to crave more
Yeah,
of that
yeah.
product.
And cancer feeds
On
sugar.
sugar,
Yeah,
absolutely.
yeah, yeah.
Two things they want in your food: salt and sugar.
That's why, Velma, I'm very careful on what I eat now.
Yeah.
And maybe when it comes to corn, I don't eat corn anymore.
Well, you can if you can find it
Yes.
organic.
Well,
'Cause
I know, but I just cut corn out.
Yeah.
But I'll if it's non-GMO, then I'll probably eat the corn. But I almost 100% I cut corn out.
Well,
And-
that's because you can't trust it anywhere.
And this is where it comes. I'm glad you mentioned that, trust. How if the Food and Drug Administration is going to have us trust them, our government? They have to make sure that they protect the public.
Well, they're supposed to be the governmental watchdogs.
Right.
And those dogs have been asleep because they're not, or they're being paid, to look the other way. They're watching something else. The money that's going into certain pockets or certain politicians. I'm not saying who, what, when, where, or why, but we know the why: big money, big profits, but it's always at the risk of human health. And here's what I notice about the Food and Drug Administration. Everything will have this label on there, USDA approved.
Yeah.
And then 3 to 5 years down the line, of course now you see 1 to 2 years down the line, studies have shown that this is causing cancer. Juvenile diabetes, juvenile arthritis, arthritis, all kinds of things. And so we're pulling that off the market. They knew it in the beginning, but they waited till they had to take it off.
So you're saying now, Velma, that if these young kids have adult diseases now,
Yeah.
because of the products that we have out there,
We are consuming and
it starts in the fetus, probably.
Exactly. In fact, one of the things I was bringing here was that what they were looking at in the I wanted to find it because it was regarding infants and mothers. But anyway, let me just I'm gonna just see if I can find it real quick. Okay, let me see.
Yeah,
I wanted to. They tested mothers and babies' blood.
So now blood, yeah, and they test the blood as it in the umbilical
Here
cord.
it is.
In the umbilical cord.
Okay, doctors at Sherbrooke University Hospital in Quebec found that corn's Bt toxin in the blood of pregnant women and their babies, as well as in non-pregnant women. Specifically, the toxin was identified in 93% of 30 pregnant women, 80% of umbilical blood in their babies,
Yes.
and 67% of 39 non-pregnant women. The study has also accepted for publication in the peer-reviewed journal, and that means the journal is called Reproductive Toxicology.
So then they're being born with toxic chemicals in their umbilical cord at the beginning
Yeah,
of
because
their life.
See, Bt is one of the toxins that Monsanto puts, and it's in corn. They call it Bt corn, but they knew it would add a deadly poison into the food supply. That's what it's designed to do. The corn's DNA is equipped with a gene from soil bacteria called Bt, Bacillus thuringiensis, that produces the Bt toxin. It's a pesticide. It breaks open the stomach of certain insects and kills them. But Monsanto and the Environmental Protection Agency swore up and down that it was only insects that would be hurt. The Bt toxin, they claim, would be completely destroyed in the human digestive system and not have any impact on all of us trusting corn-eating consumers. Oops, The study just proved them wrong.
And this study was done out of where?
This is Jeffrey Smith, and he's a person that deals with regulating the. I had his company on another paper.
So why is that so important in the communities like here? So important in education.
Okay.
Because when the baby was born, they have these diseases already. When they get into preschool, first grade, they have learning disabilities.
In learning disabilities, you have a higher incident of I forgot the birth defect that makes kids not function hardly at autism. I was trying to think.
Okay.
Autism. And so you have more incidents of that. You have more incidents of diabetes. You have more incidents of obesity. And now even children, when they get to their teen years, have to really have their hearts and other organs tested to make sure they're because these things affect kidneys and livers. Anything we digest has to go through the kidneys
to clean it out. Yes.
To clean it out. And so when these toxins are in there, that's an interrupter to the process. And so therefore, there are people who even handle this stuff are dying or getting harsh rashes from handling GMO cotton, GMO corn, GMO everything. And so the top 10 genetically modified foods, which you can't
could you
see
read it out loud?
Corn, soy,
cotton,
papaya, rice, rapeseed, which
okay.
you know as to be canola. Canola, the rapeseed is a genetically engineered seed from the start. And when it came out, it was supposed to be a cheaper version of an oil that would do the same thing as olive oil. So it's very cheap, but many people, and I have a sister who can taste it and she gets sick immediately. Potatoes, tomatoes, dairy products, and peas. These are the top 10s. And another article even added some of your squashes like zucchini and things like that. So how do we avoid all of this? Yes, Whole Foods market does sell things a little bit high. They're trying to come down, but there's another store over there on Ogden and North Avenue called Stanley's. They have a nice organic section, and they do sell them much cheaper. And so just go, and even now, because it's becoming important, guess what was in the news recently? Because organic people are knowing, I don't want to disseminate all this information. I just want to know what I should eat. So they know to do organic. So guess what Walmart is doing? They have teamed up with Wild Oats, and Wild Oats is probably a subsidiary, I think, of Whole Foods, because Whole Foods bought up some of the Wild Oats stores in other cities. And so now Walmart will have organic foods. So now you consumers who are concerned about getting foods cheaper, be on the lookout. Walmart is on its way. I don't shop at Walmart because it's not cheaper than Aldi's.
You know what? Every day I get this newsletter.
Yes.
Above the Fold.
Yeah.
And they came out with a research that they did on rice.
Yeah.
And that there's a lot of arsenic in the rice. And now they found out there's other toxic chemicals associated with the rice.
Yes, because as you know, arsenic has always been used in plant cultivation and stuff, and I guess foodstuffs too. But now the way we want to mass produce and quickly produce stuff, some of those poisons are getting into the human digestive system and tearing up our human health. Now, if you remember when we used to do the shows before, arsenic is put in your chicken to make it fat.
And I just found the article.
Mm-hmm.
that the arsenic uh, is being absorbed, the rice is absorbing the arsenic, and also they found out that cadmium, which is
Yeah,
the cadmium is being absorbed by the rice, and it's in the above the fold, and they did a research at Dartmouth College
yeah.
and the article is the trouble with rice. Now I was growing up on rice,
Yeah.
and I love rice. All the Asian people love rice. We all love rice.
Yeah,
And here now they come out with rice. Be careful on the amount of rice you eat every week.
Okay,
So,
well, see, this is why I'm saying I'm really promoting going organic. And how you know
and this
if-
was in the New York Times.
Yeah. Well, yeah, because it's coming out. This has been known for over 10 years, but it's coming out now because it was, first of all, written about in John Robbins' Diet for a New America, not the GMOs per se, because that book was written in, I think, in the 70s or 80s, but his newer version of that book called The Food Revolution, that's the book to read. Now, John Robbins is the heir to the Baskin-Robbins fortune. But when he studied the industry of making ice cream and dairy products, he was blown away about the impact on the environment, the impact on the care and the treatment of animals, and the impact on human health. He gave up all those millions and billions of dollars he could be living off of now from Baskin-Robbins and started this caring organization.
Now the group that you just mentioned,
Yes.
papaya.
Yeah.
We all like papaya.
Yeah.
So all of the Hawaiian papaya is GMO, unless it's organic.
Well, they're saying like 80%. I guess, yeah, that would be. That means the other 20% is organic.
Yeah.
Now, here's the thing to know when your food is organic, just in case you want to know. You've heard of the PLU number. That means product lookup.
Okay.
And on that tag you hate to pull off your fruits and vegetables, that's your product lookup number.
Okay.
And if it's a 4-digit number,
Or
80% to 90% of it is GMO.
okay.
If you have the 9 before that same number, that means that is organic. It's the 9. In other words, I think like an apple, maybe the number might be 4211, or bananas are 4311. But if it's 94311, that means it's organic.
You know, I like to say a quote from Martin Luther King Jr.
Oh, okay.
And this is his quote: "Never, never be afraid to do what's right, especially if the well-being of a person or animal is at stake. Society punishments are small compared to the wounds we inflict on our soul when we look the other way."
Yeah. Well,
Martin Luther King Jr.
absolutely.
And that's why I love Reverend Velma King, because she's never afraid to say what is right. And especially in here, in the communities where there's food desert, in areas that where do they get their food and what kind of food do they serve, and what kind of food are we eating,
Yeah.
and fast food, processed food, and these are this is why I think that vegetable gardens are going to come back if we make people aware on how to make
they
vegetable
are already
gardens.
back. They're in
Yeah.
people's backyards now. They're also, as some people know in Chicago, when summer comes, there'll be neighborhood gardens. So those are kinds of things. But we just have to be assured that they're using the right chemicals to cultivate, because if you're using Roundup, it's not safe. That's Monsanto's product. Now, the looking the other way is very important, how dangerous it is, because down the line, it may not be you. It might not even be your child, but it will be your grandchild.
Yes.
Because the more we allow this to be a part of our genetic makeup or our genealogical makeup, we're passing the resistance to our children. So therefore, how come we're seeing so many more hospitals built. How come this health industry, the healthcare industry, is such a billion-dollar industry? It's because we're getting sick.
And how come we're having trouble in our education? Because right now, they say our kids are not learning like the other kids. Maybe in Europe, where they do not allow GMO, and they have learning disabilities in
Absolutely.
school, and the teacher said we can't teach the kids, and so they send them out to a certain special school. They handle these type of kids.
Right.
You know.
Right, because some of those chemicals not only have allergic reactions, certainly they have impact on the brain. If they're finding it in the blood of babies in the umbilical cord, that means it's traveling into that body and doing something to some part of the body. Some persons, it's the brain. Some persons, they just get an allergy and they say, I'm gluten intolerant.
Yeah.
You and I are old enough to know that about 30 years ago, no big talk about allergens in food. Why is that? No GMOs or fewer GMOs.
And it's a big problem. That's why Velma King likes to talk about how to help people staying healthy.
Yeah.
And now she's talking about GMO. What is your opinion on labeling?
Labeling is the most important part. That's, as I said, I went to this hearing in Illinois where I listened to the legislators talk about some, representatives talk for the pros and the cons. Well, the cons is always, it's going to cost too much to put that extra label on there. Oh, blah, blah, blah. And the other side is telling you that people need to be informed. They just want to be, they want to know what they're eating. I have a right to know what I'm giving my baby. And if I want to take the risk, and that's what they're doing. They're teaching us to play Russian roulette with our lives. It didn't get me, okay, so it passed me, so it's okay for my child? No.
Yeah.
So that's what we need to do. We cannot look the other way. We must. Now that I live in a senior building and they show you how to use a computer. If you don't go to the library or go to your own computer, there's one word that everybody has heard of: Google. Google it, right?